The Thunder Bay Regional Health Sciences Center is reporting a big increase in the number of COVID-positive patients inside the facility, both in the dedicated COVID-19 unit and in the ICU. The hospital also confirmed today that 30 staff members will soon lose their jobs after refusing to comply with the hospital's mandatory vaccine policy. Corey Nordstrom has more.
The impact of COVID-19 is rising at the regional hospital. They're now at 33 active patients in hospital, up 7 from Thursday. And one more person is in the intensive care unit, bringing the total there to 9.
It's a 208% increase since the end of December. That represents 105 new admissions with an average length of stay of 6.27 days. And in addition to that, 24% of all of those admitted to hospital will require some type of intensive care stay.
Hospital officials have not expanded the designated COVID unit as of yet, but remain flexible. Crocker-Ellicott is clarifying that some of the 33 active patient cases were originally admitted for reasons other than the virus.
As of today, 80% of those admitted to hospital are admitted with a primary diagnosis of COVID or for COVID-related illnesses. 20% of those are admitted for other reasons.
The regional currently has 95 staff off duty, either isolating or having tested positive for the virus, though it's actually been worse in the last week or so, reaching over 160. But the hospital has been fortunate enough to still meet the region's needs during that time.
We've had staff that we're able to redeploy to different areas to ensure that we're able to manage the ongoing clinical care needs. In addition, with Directive 2 and the ramp down of services, that's enabled us as well to have more staff to be able to redeploy to areas of need.
Meanwhile, it's been 1 week since all hospital employees needed to get at least their first dose to fulfill the regional's vaccine mandate. Crocker-Ellicott originally thought they'd lose about 25 staff due to the policy. The actual number turned out 30 currently on leave of absence for not showing proof of vaccination and will eventually be let go. Job openings have been posted to replace them, but the door isn't completely shut on their return.
Every single individual that we can encourage to look to the policy and reconsider, we'll work with them, absolutely. There's not if you don't do it now, you can never come back. Absolutely, we will welcome people back with open arms should they reconsider.
Crocker-Ellicott says that 4 of the 9 COVID-positive patients admitted to the hospital's ICU are unvaccinated. That 44% is on par with provincial numbers, as 232 of the 532 patients admitted to Ontario ICUs are not vaccinated. Corey Nordstrom, TBT News.